Hello everyone, I am Deepika Pathak. Today I am here to discuss a new topic of pharmacy practice subject, which is patient medication history interview. So, let us start with patient medication history interview. Why it is important? When the patient will come to the hospital, this is the first step the physician will do, will take the medication history. So, let us start. The patient medication history is very important aspect of the medication history. Documenting a comprehensive, of course that is why very important to document it. So, documenting a comprehensive list of patient medication allows for correct charting of medications. What we will see here is, we will see what patient had taken in the previous times, yes, either from the discharge of a particular hospital or a patient is following a particular therapy for particular disease. So, we will get the data, and this data is beneficial to start a new therapy, yes. Why we call it as new therapy? Because sometimes what happens, previous medications the patient is taking is causing side effects, maybe it is causing adverse effects. So, at least we can get the data, is a particular medication causing adverse reactions. So, at least we cannot give that particular medication to the patient. Now, and of course, they are one of the reasons why we will take the patient medication history, especially when the patient undergoes the poisoning. Yes, the patient had taken or abused with a drug. So, at that time it is very important what drug patient had taken, so that a physician can start the therapy. Yes, it will save the time and it will start the treatment in a fast pace. Now, there are some of the sources from where we can take the patient medication history. What are these sources? Of course, the patient itself. At the time when the patient is conscious, when the patient is not conscious or patient is not aware, patient forgets what patient had taken, of course, who will give the information? Their collaterals. What do you mean by collaterals? The family members and their relatives or friends who are aware about the medication what patient is taking. So, from them we can take the information. Of course, the medication boxes, in the medication boxes from the number of pills, and so medication boxes means often patient present with their medications ask if there are any missing. So, on that basis we can see what patient had taken previously. Patient's file, I told you, if the patient discharged from any of the hospital or patient is following any therapy, of course, the patient had its file, which is called as a discharge summary. So, they are the medication, list of medications we can see from them. The patient physician or pharmacy, and the last option is the patient physician. If we are not getting the data from anywhere, of course, we can contact with the patient physician, we can ask about the medication, or of course, the pharmacy the patient is following. Now, information need to taken for medication history. What information we want? See, prescription. First point number 1, prescription. In the prescription, we want what formulation patient is taking. So, it could be the formulation means the patient, if the patient had taken tablet, or the patient is following syrup, or the patient is following injections. So, this means the form, and the administration, by which route the patient is taking. It could be the oral, it could be the IV, it could be the IM, these all, it could be the dermal preparation. So, these are the administration, how the patient is taking medication. Dose, in which dose the patient had taken medication, it is also reported in the summaries chart, in the discharge summaries. So, it could be 100 mg, it could be 250 mg, it could be in micrograms. So, like this the dose will see, and frequency means how many times the patient had taken particular medication. So, it could be OD, one day, one time, means another could be BD for 2 times, or thrice a day, TDS. Now, indication. Of course, we know the patient is taking the medication in this form, in this administration, in this dose, and the frequency from the prescription. Now, the second point we want is called indication. We want, if a particular patient is taking metoprolol, so why the patient is taking metoprolol? So, indication is the patient, if the patient is taking metoprolol, so the reason is the hypertension, patient has a BP problem, yes. So, we want to know the medication of each of the medicines the patient had taken. Another is the prescriber, who prescribed you to take the medication. Sometimes what happens, the patient is taking OTC medication, over the counter medication, without any prescription. There are some of the herbal supplements and they are causing serious side effects. The patient after taking the herbal supplement hospitalized in a patient. So, what happens? We want to know who is the prescriber, who prescribed it. Another is the timing, when the patient had taken it. So, we want to know if the patient had taken 1 hour before reaching the hospitalization, 2 hours before, 2 days before. So, like this the timing. Now, side effects. Side effects, if patient reported any side effects, it could be anything. So, there could be, the patient suffers from anaphylactic reactions, the patient suffers from skin reactions, severe skin reactions, high blood pressure. So, these are some of the side effects the patient can suffer after taking a particular treatment. That is why it is very important that patient to tell about everything the patient had taken, and we can get this data either from the patient if the patient is conscious, or from any of the collaterals. Another thing, yes, see, need for the patient medication history. Why it is needed? I told you from the starting of the slide why it is important, why we are taking this medication history. So, because this is the initial step when the patient reaches to the hospital, this is the initial step the physician can do. So, recording accurate medication history is very important, part of initial patient assessment after admission into hospital. I told you. Point number 1, see, accurately documenting. This is very important. We have to know if the patient suffers any adverse effect from any of the medication. So, we will report adverse drug reaction to penicillin, like this. We will write it in the file of the patient, adverse drug reaction to penicillin, so that next time the patient will not prescribe with this drug, yes. So, accurately documenting a patient, and it should be labeled in a very dark. Okay. So, accurately documenting a patient's home medication and allergies at the time of admission. I told you, if any of the medication, home medication, if any of the allergies are reported previously, of course, we have to tell to the physician, so that any of the form of this is not prescribed again. Improves the efficiency. I told you, if we know what is the medication the patient had taken and it is not improving the situation of patient, of course, will not prescribe, the physician will not prescribe. Okay. So, either we can change the medication, of course, it will reduce the cost and it saves the time, it improves the efficiency. So, improves efficiency, quality of patient care, and medication error will be reduced here. The side effects, the adverse drug reactions, we can reduce here. To identify patient's use of non-prescription. So, while we are taking the patient medication history, we will see this data, non-prescription medication or herbal prescription preparations. So, non-prescription medication means the OTC medication, over the counter medication, which the patient will take without any prescription. Okay. Now, it saves the time, and ultimately, why? Because we are talking about the need for the patient medication history. So, what is the ultimate goal we are achieving here is it reduces the time and efforts to start the treatment. After taking all of the data from the patient, what the patient had taken as a treatment previously before coming to the hospital, we can start the treatment at a very fast pace. Now, medication history prompts. There are some of the prompts, there are some of the very easy quick questions we can ask to patient, so that patient can tell. Incorporating types of probing questions. Okay, and these are the probing questions to analyze about the medication chart. Probing questions into the patient interview may help trigger the patient memory. So, these prompts we will use to trigger the patient memory. Questions कैसे हो सकते हैं? Let's see. Question number 1. Use both open-ended questions and closed-ended questions. So, I told you we can ask the questions to patient, and there could be, the questions could be of two types. One is the open-ended questions and another is the closed-ended questions. What do you mean by this open-ended questions and closed-ended question? Let's see here. Open-ended question means where the patient can tell lot. Okay, whereas the closed-ended questions will ask any question to patient, and patient can write in a very restricted manner, like the answer could be yes or no. Okay, in open-ended questions there are lot to tell. So, we can see here in the example part, use both open-ended questions. Example, for example, what do you take for your high cholesterol? So, patient will say, I have taken drug A, I have taken drug B with this formulation, with this time, like this. Another question, closed-ended question. Example where the restricted question, the patient will answer in a very restricted manner. So, what we have asked, do you take medication for your high cholesterol? So, this is the question where the patient can ask either yes or no. Yes. So, likewise we can ask in a open-ended manner, we can ask in a closed-ended manner. The point number 2, ask patient about the route of administration. I told you in the previous slides also what information we want in a patient medication history is a route of administration other than oral. Why it is written as other than oral? Because usually patient forgets to tell about the preparation which are other than oral, generally for the skin preparations, the dermal preparations. So, routes of administration other than oral. So, we will ask, do you put any medication on your skin? These will trigger the patient memory. So, we will get data like this. Patient often forget to mention, I told you, the creams, the ointments, the lotions, the patches, eye drops, nebulizers and inhalers. So, these all point number 2, and now coming to the point number 3. So, these type of questions we can ask to the patient. Question number 3, what is here? Ask patients about what medications they take for their medical conditions. Like, what do you take for your diabetes? Like this. Point number 4, we can ask the patient about types of physician that prescribe medication. Sometimes what happens, the patient is suffering from 2-3 conditions or more than that. At that time, the patient is consulting with 2-3 prescribers, and even also the patient is following the polypharmacy, they are following the different pharmacy, they are following the more than one drug. So, like this we can ask question, does your arthritis doctor prescribe any medication for you, or does your diabetic doctor prescribe any medication for you, does your hypertensive doctor prescribe? So, like this we can ask the question, so that patient trigger about what the patient had taken previously. Ask patient about when they take their medication. So, we will ask the timing, the time when the patient had taken, it's a week or for a month as needed, etc. Patient often forget to mention infrequent dosing regimens such as monthly. So, it is very important to tell to patient or to ask the patient in a manner so that patient can tell about the time also. Now, point number 6, ask patient if the doctor recently started them on any new medications, any new medicines, stopped medication. Sometimes what happen, the patient is taking a particular medication and the medication after consulting with a physician stops a particular medication. Sometimes a week you can say, or for a month, the patient suffers from any of the allergic reactions. So, that is why it is very important to note if it is there any stopped medications also, so that we can relate if any side effects or adverse drug reactions reported at the time of admission. At the time of admission in a hospital, we can relate this data with the stopped medications also. Point number 7, asking patients what we can ask to the patient is all about the color. This also tells about the medication adherence. Sometimes the patient is saying that patient had taken this medication for a month, but actually it is not. So, we can get this information, like we can ask about the color of the pills, we can ask about the shape or size. Sometimes the patient is not aware about the name of a particular medication. So, we can get this data about the color, size or shape, and then we can recognize according to the indication that what could be the medication. So, may help to determine the dosage strength. There are some of the dosage strength in a particular shape, in a particular color, in a particular size. So, likewise. Point number 8, calling the patient's caregiver or their community pharmacist. I told you we can also take the information from patients' collaterals, their family, their friends, or from their pharmacist or the physician. They can also help to get this data. Strength, directions for the use. Now, for inquiring about OTC medication, I told you generally the patient will tell about what are the medications written in the summary charts or the discharge sheets, but the patient is not aware about the OTC medication. So, we have to ask the questions. What questions we can ask? What do you take when you get a headache? The patient can answer the paracetamol or any of the other brands the patient is taking. What do you take for allergies? So, patient can answer any of the like color, about the size, or simply chlorpheniramine like this, or levocetirizine. So, next, do you take anything to help you fall asleep? Sometimes the patient is suffering from sedation and the patient generally took a particular medication as a OTC, over the counter, which is not prescribed. So, we can get this data. What do you take when you get a cold or cold cough? Any syrup, any formulation, the patient can tell what the patient is taking from the near pharmacy. Do you take anything for heartburn or acidity? So, these are some of the common questions we can ask, which is called as inquiring about the OTC medication, and these are the additional prompts we can take to get this data for if the patient is following any OTC medication or the herbal supplements. Similarly, we have to ask some of the questions related with the herbal supplements also. Medication interview form. Let us see, this is a card for medication history script. There are some of the points, and in some of the points we can see this sum of questions, 1-2 questions are there. Like one is the allergy. So, we want data for allergy. So, that will not prescribe, a physician will not prescribe again. Prescription medications, non-prescription medication means OTC drugs. Herbal supplements, I told you for herbal supplements and vitamins. And there are some of the additional questions. We will see the additional questions. First see the allergies, prescriptional medications, non-prescriptional medications, herbal supplements and vitamins. For allergies, do you have any allergy to or avoid any medication due to side effects? So, these questions we can ask. What type of reactions do you have? It could be severe, it could be minor, it could be intermediate, and what are the we can see as a treatment measures the patient had taken or a physician actually prescribes. So, this type of questions we can ask to check the allergy. Prescription medication, what is written in the discharge summaries. Non-prescription medication, we can ask the questions we have discussed in the previous slides also, OTC inquiry. Herbal supplements and vitamins. So, there are some of the questions related with the herbal supplements. The patient is taking some of the side supplements and vitamins. So, what herbal, natural and homeopathic, and they all are without prescriptions. So, patient used to take it and there are some of the reactions also reported. So, we will get this data. What herbal, natural, homeopathic remedies do you take? We can ask like this. What vitamins and minerals do you take? When do you take them? Because sometimes what happen, we are prescribing a particular medication, as a physician I am talking of, and what happens next is there are the side effects, there are the interactions with these herbal supplements and vitamins. Therefore, it is very important to know what patient is taking or what patient had taken previously. Additional questions about, like generally what happens, the patient forgets to tell about eye drops. If patient is using any eye drops, nose sprays, puffers, medicated lotions and creams, medicated patches, that is why I told you we have to know about if the patient is taking any medication other than oral, and these all are the formulations other than oral. So, do you receive any injections, any samples from doctor's office or study medication as a sample medications the patient had taken? And sometimes what happen, like for the acidity, patient is taking any medication, for pain, slip, I told you in the previous slides for the OTC inquiry, these all of the points are covered there. Now, this is how the patient medication, his interview form is. Now, these are some of the points we see in the general information. Primary care provider, who is the primary care provider? It is written here. What are the services patient is taking, like cardiac, patient is suffering from angina or myocardial infarction. So, patient is taking that service. So, we will get this data. Demographic and social information. What we will see here is the date of birth, what is the patient height, what is the religion, patient's age, weight, if pregnancy, yes or no, like this. Now, chief complaints. If the patient is admitted in a hospital, of course, there are some of the complaints. The complaints of loss of consciousness, like this, vomiting, like this. There could be many others chief complaints also. So, this is one of the example here, loss of consciousness. So, who will tell about the patient medication history? Of course, their collaterals, their friends and family members. Now, history of present illness. This condition rises due to some of the prior conditions. So, from 1 month, it could be from 1 month patient is suffering from 1 month patient is suffering from vertigo, yes, vertigo, next is the past medication history. So, past medication history means the patient had disease of diabetes mellitus, the patient had disease of hypertension, and what are the medications patient is taking for these of the conditions, for diabetes, for the hypertension. So, we will write it Like for the hypertension, we will write the metoprolol patient is taking, tell me sartan patient is taking. Similarly, for diabetes mellitus, like this, we will write what the patient is taking. Any surgeries, any previous surgeries patient undergone, and what are the medications with these conditions. Like the patient has undergo laparoscopy. Laparoscopy will see any organ, we will write it as uterus. So, what are the medications the patient had taken, we will write. Now, family history means there are some of the diseases which patient gets, we call it as transmitted diseases or communicated diseases, communicable diseases. So, we will get this data, or some of the diseases which are genetic, and there are also some idiosyncratic reactions, genetic reactions. So, we want to data of the mother and father, how much are they living, yes or no, father are they living, yes or no, like this age disease, if they are not living, so what is the age when they deceased. So, and what is the medication history, like the like mother suffered from diabetes also, and she had taken these of the medications. Similarly, for the father also we can write. And in the form in this medication interview form, there is one of the option called the immunization history. So, patient undergone there could be the options like influenza, tetanus, pneumonia, these all of the immunization. So, we will write, because sometimes what happen and the date last received, that is why we will get this information, because sometimes what happen from the immunization, some of the reactions occur, and maybe the patient reported a particular side effects or the adverse drug reactions, and it could be due to from one of them. So, we want to know it. Another is allergies, medication, food, adverse reactions. So, adverse reactions, the patient suffers skin redness, this could be the reactions, and severity we can write type, what is type A, if it is type A, B, there could be other types also. One is the augmented type, means due to high doses. Sometimes what happens, the adverse drug reactions occur due to side effects, sometimes the adverse drug reactions could be due to there are no reasons, bizarre reactions. So, we will write type and severity. Of course, the patient do not know about the type and severity, but at least the patient can tell the product name what patient had taken. Another is the current inpatient medication. Some inpatient, if the patient admitted in a hospital previously, so there are some of the medication, this is called as a inpatient medication, means the patient, when the patient is hospitalized. So, we will write what is the medication A, medication B, these all the medication with their strength, means 100 mg, 200 mg, what is the strength, regimen for how many time, like OD, BD for 5 days, indication is fever, rashes, these all are the indications. So, current out, similarly as there are the current inpatient medication, similarly there is a current outpatient prescription medication, means the patient is not hospitalized, a prescription is given to a patient and patient is following a particular chart. So, and in a home patient is taking drug A, we can write like drug A, drug B with their strength similar as in the inpatient, like 100 mg, 200 mg, similarly OD, BD 2 times a day, 1 times a day, 3 times a day for how many days, it could be the 10 days. Indication, what is the indication, we will write it here. So, this is the form, how it is, how the columns are, how the entries are here, and we have to fill this and we will get this data about the patient medication history. Current outpatient non-prescription medication, I told you we have to get the data of the OTC medication, which is non-prescribed medication, and similarly the herbal medications. Sometimes the patient is taking some side supplements. So, this is how the form is. Another is, it is in continuation with this form, assessment of outpatient medication compliance. So, we will ask this question and there are methods. So, we have seen some of the methods, like what are the we can see the question here. So, does the patient have any difficulty in understanding or complying with medication instructions? Patient can tell any of the reasons. Is there any cost or reason why the patient had not taken, or any intentional reason or unintentional reasons, any fear, any forgetfulness. So, these are the reasons the patient can report, and if any barriers, the same thing. So, diet and exercise, if the patient is following a particular strict diet, means the patient is following high sodium intake. So, these all information are very important. High sodium, high fatty diet, these are related with the patient condition, why the patient actually report to the hospital. So, they are giving the clue. So, we want to know, so that we can, when we are prescribing a new medication, what we have to be with which we have to take the precautions. Type and frequency of exercise, how many times the patient is doing exercise, the frequency, and the able to conduct activities of daily living. The patient is able to perform daily activities without compromising. So, we have to write yes or no. If the patient is taking smoke, taking alcohol, or any recreational drug use, recreational drug means any of the psychoactive substances the patient is taking, they are generally for changing the behavior of the patient. Sometimes what happens, these of the drugs are causing some of the withdrawal symptoms after stopping a therapy or drug. So, we want to know this data, smoking, for the alcohol, and also for the psychoactive substances, recreational drugs. So, this is how the medication interview forms looks like. This is another forms similar I show you. So, thank you so much everyone. We have discussed about the patient medication history and why it is important, what are the methods, how we can ask the questions to the patient. Thank you so much everyone. We will meet in the next session.